that time of the year.
Dun, 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 dun.
Well, we get our flu shots.
Da-da-da, da-da-da, da-da-da.
If you're watching on Northland Channel 15 and you see me cry, please forgive me, because I am a baby when it comes to this kind of stuff. But in our studio is Dr. Juliette Madrigal. Did I say your name right?
Perfect.
All right. She's with the Burnet County Health Authority and local family physician in here. And just so you'll know, Juliette, the first time I met you this morning and saw you, I'm switching doctors immediately. You're the best looking doctor I've seen in a long time.
You got your morning vision on.
Hey, it's good to see you. We're glad you're in here, and thank you for coming in to administer these flu shots to us this morning. Now, your medical profession, internal medicine and pediatrics, and that's good because, as I said, I am a baby.
But we have both ends of the spectrum covered here.
Yeah, especially when it comes time to get the flu shot.
Especially because your flattery is not going to keep you from getting
That's
the needle.
right, yes.
Thank you very much.
But I did see she switched to the sharper needle. So
okay.
At least you don't get the dull one.
Oh, that's good. I appreciate that. Doctor, tell me, because I had mentioned this on the air before, but it had been in the news recently that there's a new, that the flu that's out there, it's mutated. There's even some of the flu shots, in other words, are not working on the flu that is currently out there.
Well, the flu mutates every year. So every year it's a little bit different strain than it was the year before. Mm-hmm. So this year, the flu shots we have, some of them have 3 different flus in them, and some of them have 4 different flus in it.
Okay.
You get the 4.
All right. Well, that's good.
But that's something that happens every year. There's always the flu virus is always trying to kind of keep up with us and be one step ahead of us, and so that's
Correct.
why there's
Viruses are very smart.
it's tricky little things.
So what we hope is that it only changes a little every year.
Mm-hmm.
What we fear is a big jump and a big change. And when that happens, people don't have any immunity to it.
Right.
The little changes that happen every year, you get a little immunity every year whenever you do get the flu.
Gotcha.
And people that get flu shots are the younger, the kids, right, and the older folks. What about the folks that are in the middle ages?
Everybody should get a flu shot.
Yeah.
But the people at greatest risk are at the extremes of age.
Okay.
And when exactly is flu season? I always get kind of confused because I've heard people talk about flu season as early as October and talk about it as late as like May.
Well, the weird flus we had, like the H1N1, that actually started really early.
Yeah.
The really dangerous flu of 1918 was also in the fall. But the vast majority of our flus, especially here in Texas, are in January, February.
All right,
So we're
this
not
is
there
the perfect
yet.
time to
Perfect
get
time
it.
to get your shot.
And when we get the flu shot, how long does it last? Does it last for an entire year until this time next year?
No, it lasts about 3 months, really.
Yeah?
That's when it's
Okay.
going to peak. You'll have a little bit of immunity throughout the year, but you really want to get it after October because you want to still have some immunity into January, February.
Yeah. Well,
So-
we might want to wait till January.
No, this is perfect.
There's no putting it off, dude.
And it takes about 2 weeks to work, so this is perfect.
Yes, and that's what I was going to say because he's always saying, "Oh, every time I get the flu shot, I get sick." Well, that's a myth, right?
That's a myth.
It is a myth.
That's a coincidence.
Yeah.
Because of the fact that it does take a while for that flu shot to kick in, sometimes you can get sick prior to the flu shots kicking in, and that's
Okay.
why you're thinking that the flu shot is giving you.
All right.
And the flu shots that we give don't have any, or these don't have any live virus. There's a nasal spray that we
Right.
give to children that does have some live virus, but those have not been shown to actually give any of the kids the flu.
Right.
Okay.
And one thing too, I've always, I've known a lot of people. They'll get the flu shot and then they'll think they're completely safe from the flu, and they go around, they don't wash their hands, and
Right. Or they think
they
they're,
lick railings.
or they think they're immune from every cold.
Right.
And this only treats the flu.
Exactly.
And most people only get the flu about 3 or 4 times in a lifetime. And when you have the flu, you are really sick.
Yeah, absolutely.
Yeah.
Now, this is recommended, as you said, for everyone to getting the flu shot. What about shots for pneumonia? I understand there's some sort of vaccine out for pneumonia as well.
Yes, and those are recommended for people who have risk factors like asthma or a low immune
Smokers.
system, and for people who are 65 and over.
Okay. All right. All right. Good.
And
Well,
those last 10 years.
Oh,
10
wow.
years. Okay, good. All right. Well, I guess it's time. It is that time. You
Well,
want to go first?
real
or you wanna
quick,
go
let me
first?
ask one more thing because I'm sure you're available for flu shots at your offices. Should folks call ahead and make an appointment for those?
No, just stop by.
All right, and your offices are located at, let me make sure I got this right, 715 Highway 1431 in Marble Falls.
house?
Nope, actually.
Oh,
we
I lied.
moved.
Well, oh, you moved. Okay, I'm so
We're
glad.
on 105 Meadow Lakes, so right before you get to Meadow Lakes proper.
105 Meadow Lakes. Oh, cool. In that little office complex there.
In that brand new building.
Beautiful. Well, congratulations on your move. Okay,
right.
now we're ready. Should I
right.
go
Who's
first?
first?
It's up to you. I don't know.
All right, you big old baby. I'll go first. Here we go.
All right, Kay's going to get the first flu shot.
All right, which
So
does
here
matter
we
what
go.
arm?
No.
Does it matter you, Daniel?
Taking pictures of the
Daniel's
picky in
taking
here.
pictures.
Yeah.
Giving you
All right.
all the,
I can't hear her. I can't hear her.
Oh, here, hang on.
Daniel, move the microphone.
I'm giving you all the subcutaneous ones, so it doesn't go as deep. So it doesn't, I don't think it hurts as much, and it definitely isn't as sore afterwards.
Oh, okay, good. I like that idea. All right, there you go. She's not saying a word. She didn't feel a
See,
thing.
it's a little pinch.
It's a little pinch.
Okay.
I've had a child.
Well, that's
This
true.
is nothing.
Yeah. Why is it, doctor, that men are more babies when it comes to being sick than the ladies?
I do not know, but it is true.
It is, isn't it?
It's so true.
Absolutely true. All right.
Are we good? Are we
Yeah,
good?
you're not
All right,
even
thank you.
bleeding.
All right.
You're a
She's
champ.
very good too. You won't get.
Okay, come on over here, Kay. You got to take
Oh,
over
okay,
for me
all
because
right, okay.
I got to walk over there to get the flu shot. All right.
All right.
All right.
Here goes Ed. Here's your
Be
play-by-play.
Give me an arm.
He's only shivering a little.
I'm thinking about not giving it in the arm on him.
Oh, you
okay.
think? All right, pull down your pants.
I knew I liked you.
All right, he's just quivering a little. I'm proud of you so far, Ed.
Yeah, okay. That's good. Last year, I screamed.
Yes,
Oh, don't
like
scream,
a little
don't
baby.
scream. This one's actually a smaller needle.
Okay,
so.
good. All right,
1,
good.
2.
Ah!
You did great.
I felt it, though.
But just barely.
Yeah, well, okay.
Doesn't it feel
You
good
did
to have
so
protection?
good, Ed.
Yeah, it's good to have it done. All right, good. Thank you, doctor.
Bravo.
So
Thank you,
welcome.
Dr. Madrigal.
That was the next question I had, though. You mentioned that you think about not giving it in the arm. Do you always have to give a flu shot in the arm, or can it go in the buttocks?
It depends on how bad the patient is behaving. It should go in the arm.
All right, great.
All right. Thank you,
Well,
Dr.
yeah,
Madrigal.
thank you.
See, that was,
It's a pleasure meeting you, and thank
Nice
you for
meeting
coming
you
in
too.
and giving us the flu shots.
thank you for protecting us
Do
for
I
flu
feel a
season.
little warm now, do you think?
You're still fine.
Okay, all right. Thanks again, Doc. We appreciate it.